This is Chapter 18, Module 8, Hormones and Growth. The learning objectives of this module are 1. Describe the hormones important to growth, and 2. Describe the conditions associated with underproduction or overproduction of these hormones. There are several hormones that are important for growth: the growth hormone, the thyroid hormones, insulin, parathyroid hormone or PTH, calcitriol, and the reproductive hormones. The growth hormone is necessary in children for the development of both muscles and bones. In adults, the growth hormone continues to function to maintain normal blood glucose levels and to mobilize lipid reserves as well. An underproduction of growth hormone would result in retarded growth, abnormal fat distribution, and low blood glucose hours after a meal. An overproduction of growth hormone would result in gigantism or acromegaly. The thyroid hormones are also important for growth as they help cells increase production of ATP. If absent during fetal development or in the first year of the baby's life, the nervous system will fail to develop normally and mental retardation could result. Obstetric patients have their thyroid levels measured throughout their pregnancies. If the T4 or thyroxine levels decline before puberty, normal skeletal development will not continue. Underproduction of thyroid hormones causes a condition called cretinism and results in low metabolic rate, low body temperature, and impaired physical and mental development. An overproduction of thyroid hormones results in a condition called hyperthyroidism or Graves' disease and results in a high metabolic rate and body temperature. Insulin is necessary for growth because it allows the passage of glucose and amino acids across the plasma membrane. Glucose and amino acids are used for the production of ATP. An underproduction of insulin results in a condition called diabetes insipidus and may result in polyuria or excess urine production, as well as dehydration and thirst. An overproduction of insulin could result in increased body weight. The parathyroid hormone promotes the release of calcium from bone, and calcitriol promotes the absorption of calcium salts in the intestines from ingested foods. Both of these hormones help to increase the levels of calcium in the blood. An underproduction of the parathyroid hormone could result in muscular weakness, neurological problems, formation of dense bones, and tetany due to low blood calcium concentrations. Just think of the physiology we've already covered for skeletal muscle contractions and also at the synapse in regards to how calcium is used in both of those theories, and think about what would happen if calcium was unavailable. An overproduction of parathyroid hormone and calcitriol leads to neurological and muscle problems as well as weak and brittle bones. The reproductive hormones are the androgens in males and the estrogens in females. These hormones stimulate cell growth and differentiation in target tissues. They produce different effects in the male as they do in the female, including the skeletal proportions and the secondary sex characteristics. Underproduction of androgens and estrogens could lead to sterility or lack of secondary sex characteristics. An overproduction of these hormones could lead to testicular tumors in the male or increased breast enlargement. If these hormones are overproduced during puberty, premature sexual maturation and related behavioral changes could occur. This ends Chapter 18, Module 8, Hormones and Growth.